Hello, I'll be doing my clinical mental health counselor assessment and presentation on bipolar 1 disorder. Alright. So the proposed treatment program that I will be doing my assessment project on is individuals who are recently diagnosed with bipolar 1 disorder. They will be the focus of this treatment plan. Diagnosing bipolar disorder is very difficult due to the comorbidities such as depression, anxiety, ADHD, even schizophrenia, and the lack of recognition of symptoms in the individuals, which means that it could take years before the individual is finally diagnosed with bipolar 1 disorder. And the research that I did my annotated bibliography on was saying that it could take 5 to 10 years before a diagnosis of bipolar 1 disorder is identified. Receiving a diagnosis of bipolar 1 disorder is very life-changing and will not only affect the individual but the family involved, social and occupational life of the person who is diagnosed. So many individuals that have bipolar 1 disorder are okay with their symptoms sometimes because manic symptoms can present themselves as being positive, such as having high energy and very goal-oriented. But over time, that cannot last, and eventually the individual will be in full mania and could experience symptoms such as psychosis, which involves delusions, which is very difficult for the entire family of the person with bipolar 1 disorder. So this program that I came up with is based on literature from the annotated bibliography that I did. So the DSM diagnosis of bipolar disorder is contingent on mania and depression, yet the subtypes and criteria are specific for determining how often and how frequent manic and depressive episodes last, which can make diagnosis complicated. So this means that symptoms for mania need to last more than 4 days and for at least a week, usually. They have to be measurable symptoms and observable by others. It cannot just be one person or just the individual. Usually, like I said before, usually the individual may not be aware of these symptoms if they've been living with this for a very long time. Also, the depressive symptoms need to be measurable and observable as well. So the diagnosis of bipolar disorder is highly stigmatized and will alter the individual's life. Learning that you have this disorder means that you have to take a medication regimen and follow that very strictly, which can be difficult for many people. So providing a proper treatment program and orientation to this new way of life will be critical in a positive prognosis for the client. So the more that this individual receives proper treatment, meaning going to their psychiatrist regularly, having a support system, whether it be at home or a counseling group like the one that I'm proposing, all of those lead to a higher prognosis for the client, a more positive prognosis. Research suggests that combining pharmacology with a therapeutic approach reduces the increased severe symptoms of an individual with bipolar disorder over a long period of time. So this means that with the combined approach, a multi-level approach, that the client is more likely to have a positive prognosis as compared to just taking a medicine. Implementing a multi-level approach when treating a client will be needed when practicing other methods is not working for that particular individual. So combining a psychoeducational approach or alternative therapy approach like how I'm proposing is more beneficial to the client and teaches them how to deal with coping skills of this new disorder that they have and just coming to terms with having bipolar disorder. So research proves that combining a therapeutic approach with a drug therapy provides the best prognosis for the individual as compared to providing singular pharmacology. Current research also suggests that individuals who take their medication along with an alternative therapy experience fewer episodes than before the combined treatment approach. So this means that individuals who are just taking their medication are more likely to have a relapse or not be able to understand what's going on with them and how to and when to receive more help. They could experience hospitalizations more than the individual who's having a combined treatment approach. So needs addressed based on this treatment program are, therefore, it seems that from the research provided that helping to bridge individuals who are already receiving pharmacological treatment, such as mood stabilizers or antipsychotics, antidepressants, with an alternative treatment group where different therapeutic approaches will be implemented, will be successful in educating the client as well as building a sense of community in the group counseling approach and reducing manic and depressive episodes due to being more educated on the bipolar disorder and how to take care of oneself and detection of new episodes. So the needs that are met will be education on bipolar 1 disorder, education on the individual's triggers of mania and depression. They will learn coping skills to deal with stress. Support and self-care for caregivers will be also a part of this program. Communication enhancement training, so learning how to communicate your needs and your feelings. Resolution of interpersonal problems, avoiding substance use due to a lot of individuals being diagnosed with bipolar disorder have a substance-induced bipolar disorder type. And early detection of new episodes, importance of sleep and routine, and goal setting. So the treatment program details is a 6-month-long treatment program where multiple therapy approaches will be taught in a psychosocial group therapy approach in conjunction, this is important, with the client's compliance with their medication as prescribed by their regular psychiatrist. Clients will meet once at 8 p.m. once a week for 6 months to discuss problems, concerns, stories, successes with their current diagnosis of bipolar 1 disorder. Group therapy will allow for clients to share their experience with bipolar 1 disorder and build a sense of community amongst each other. The therapy approaches that will be integrated into the group therapy psychosocial group will be psychoeducation of the disorder, mindfulness techniques, cognitive behavioral therapy techniques, family interventions, interpersonal and social rhythms therapy. So budgetary suggestions, due to many individuals that are recently diagnosed with bipolar 1 disorder, they have financial concerns, they're not able to keep a job right away sometimes. So having the treatment program will be funded by a local church group in the community which will house the weekly meetings. Therefore, there will be no cost for that. Group counselors will be the college graduate students in the counselor education program who have taken COAD 6415, clinical mental health counseling, and will be supervised by faculty members who are licensed professional counselors. And those individuals in the treatment program will provide evidence of receiving medication from their current psychiatrist to provide the best prognosis of the combined treatment approach. As of now, there are no other costs to be associated with the treatment program. So the promotional materials to gain client interest and clients will be advertising in the community, such as flyers in local restaurants, brochures in doctor's offices, and then flyers in the university commons areas and apartment complexes to reach younger adults who are affected. For the evaluations, the clients will receive a pre-assessment before starting group counseling, as well as a post-assessment to determine the effectiveness of the combined treatment approach. And the counselors will review initial assessments and alter treatment approaches to best suit the majority of the clients. So some possible impediments will be transportation to the church for weekly meetings. That could be difficult due to financial concerns. A 6-month-long treatment program is a big dedication, and maintaining and monitoring the members could be a challenge. Getting members to join and be a part of a group of people where they share their experiences with this disorder could be difficult as it's highly stigmatized. And measuring the effectiveness of the treatment program will be difficult if members are not regularly attending the group counseling. and it may be noticed that some clients will need individual counseling, which could require additional funding, or a referral will be needed to best serve the client. There's the references. Thank you so much.